and for accepting my invitation for the Community Day. We're really looking forward to this presentation, especially this period. Just a very, very quick bio of Dr. Chopra. Dr. Anand Chabra has been a physician with the San Mateo County Health for 21 years and the medical director of the Family Health Services Division since 2015. Since October 2020, he has served as the chief of the COVID-19 vaccination branch. Prior to joining San Mateo County, Dr. Chopra served as a medical epidemiologist and public health physician with the California Department of Health Services. He is also a graduate of Stanford University, the University of Washington School of Medicine, and UC Berkeley, and trained in pediatrics and public health and general preventive medicine at UC San Francisco and UC Berkeley. He is board certified in public health and general preventive medicine and a fellow of the American College of Preventive Medicine. So thank you so much, Dr. Chopra. And he will give us a presentation and we'll have 10 minutes for questions. And if you have your questions, please put it on chat or we'll also unmute you and you can ask directly. Thank you, Dr. Chopra.
Thank you so much. Can you hear me okay?
Yes.
Very good. And you all are seeing my slides, correct?
Yes.
Yes, okay.
We can see you.
Thank you. Well, good morning, everyone. Almost lunchtime. Thank you for inviting me to speak today. Today I'll present some information just on COVID-19 vaccination with the San Mateo County perspective. But I'll also talk about what's happening in terms of the various vaccines, talk a little bit about the safety of vaccines, as well as the vaccine distribution process, again with the San Mateo County focus. And then talk a little bit about public health recommendations for folks who are already vaccinated. And then I'll be happy to, as Tina mentioned, respond to questions. The guiding principles for San Mateo County Health around COVID vaccination are those of safety, transparency, and equity. We want people to understand that the vaccines are safe and also to administer them in a safe way. Really be transparent about what we're doing, how we're doing it, what data we have, what data we don't have, and then be equitable in providing vaccines to everyone who needs and wants vaccination. Of course, it's a voluntary process. On the slide, you'll see the 3 currently approved vaccines in the United States. And of course, there are other vaccines being used elsewhere in the world, but these are 3 approved by the Food and Drug Administration under emergency use authorization because we're in a pandemic. There's the Pfizer BioNTech vaccine, which was the first one approved, the Moderna vaccine, which was the second, and then most recently the Janssen vaccine, also known as Johnson & Johnson, was approved just a few weeks ago. All 3 of them have been also reviewed by a vaccine scientific safety group in California, and this is actually a group made up of several of the Western states and experts from those Western states. And they also looked at all the data that the FDA was looking at and the Centers for Disease Control and Prevention and came to the same conclusion that all 3 vaccines are safe and effective and should be widely available. The first 2, Pfizer and Moderna, are messenger RNA vaccines. That's the kind of vaccine, how they're made, whereas the Janssen is a conventional viral vector vaccine. Pfizer and Moderna, as I'm sure you know, have 2 doses to complete the series, whereas Janssen has 1 dose. And I'll talk a little bit more about the effectiveness of each of those in the next few slides. The Pfizer vaccine, the second dose should happen about 21 days after the first. Fortunately, the CDC, gives an allowance for 4 days on either side of that 3-week period. So somewhere between the 17th and 25th day after the first dose is ideal. but they also say that, up to 6 weeks after the first dose is acceptable if you can't get it sooner. Same is the case with the Moderna vaccine. So it's, the ideal timing is 28 days after the first dose, but it can be anywhere between 24 and 32 days, and even 6 weeks after if it's not available before that. And of course, the Janssen vaccine does not require a second dose. I think it's really important to note that the 3 vaccines and the clinical trials on which the FDA approval was based, the 3 vaccines, the trials are not directly comparable. And because of this, the Advisory Committee on Immunization Practices, which advises the CDC, states there's no preference for any of the 3 authorized vaccines. Basically, they say, whichever one's available to you is the one you should get. And this is in part because the vaccines were not studied head-to-head. They were approved at different times and studied in different locations. So obviously the Pfizer and Moderna vaccine, the trials happened several months ago. They were approved several months ago. And at that time, there were less variants circulating. So we have less information about how effective they are against the various variants that are circulating now in the US and throughout the world. The Janssen vaccine, however, was tested in several other countries, and I'll get into more detail about that, where there were variants circulating. And so we do know that it's quite effective against the circulating variants. And because of these differences in terms of where and when they were tested, and also that, the incidence, so the number of COVID cases, we obviously went through a huge surge over the holidays. Pfizer and Moderna, they were tested before that huge surge, whereas Janssen, the surge was, there were much higher incidence levels happening at the time of testing. So they were the phase 3 clinical trials happened in quite different times and places. What they did find, so in the Pfizer, and this is again the phase 3 clinical trial results, they found that it was effective for people 16 and older, and it prevented 95% of lab-confirmed symptomatic cases. So someone who actually was having symptoms of COVID, had a COVID test, and came back positive. 95% of those were prevented by full vaccination with the Pfizer vaccine. And it was 100% protective against hospitalization and against death. But there were also no deaths in the placebo group for the Pfizer vaccine, again, because there were lower circulating levels in the community of infection at the time. Now we have similar information for the Moderna vaccine, and I thank the CDC for these slides. They have been provided by the CDC. Moderna was found to prevent 94% of symptomatic lab-confirmed cases, so very similar to Pfizer. It prevented 89% of hospitalizations, but there were a few more hospitalizations than for Pfizer. So here, there was 1 hospitalization in the treatment group and 9 in the placebo group. If we look back to Pfizer, there were 0 in the treatment group and 5 in the placebo group. And then back to Moderna here, there was 1 death in the placebo group and no deaths in the treatment group. And again, the treatment group was the group that got vaccine. The placebo group received a placebo, so they did not receive vaccine, but they were randomly assigned to one or the other group. And when you look at the Janssen vaccine, and this is also approved for those who are 18 and older, you can see that it was tested in South Africa and in Brazil, and particularly in those 2 countries, there were variants circulating pretty widely at the time that this phase 3 trial happened. So we do know that it was quite effective against preventing infection by those variants. Now, the vaccine efficacy for symptomatic lab confirmed cases was lower, it was 66%, but as you can see, there were many more cases both in the placebo group and in the treatment group. It prevented the vast majority of hospitalizations, 93%, and there were 7 deaths in the placebo group and 0 in the treatment group. So it was 100% effective in preventing death. So because of, again, the differences in when they were studied, you'll see some differences in the percentages, but I think the most important takeaway point is that all 3 are very effective against hospitalization or death from COVID, which are, of course, the outcomes we are most concerned about. And so this, just going back to the review, so these, again, are the 3 products. As you can see under effectiveness, different rates of effectiveness against symptomatic infection, but they're all very effective against preventing hospitalization and death. The most common side effects for all of these after you get the shot, hopefully many of you have at this point, are pain and swelling and redness at the injection site. That's pretty much universal, and the vast majority of people who get the vaccine actually get those symptoms. Other common symptoms are chills, fatigue, headache, and with Janssen also muscle pain, though you can definitely have those with the other vaccines. So those are common side effects. They usually resolve by themselves within a day or 2, sometimes 3 days. And they tend to be a little more significant after the 2nd dose of vaccine. All right. In terms of vaccine safety, what you need to know about the vaccines is they are all 3 safe and effective. Millions of people in the US have received COVID-19 vaccines, and they go very intensive safety monitoring. In addition, all the adverse events do have to be reported to the CDC's vaccine adverse event reporting system. So there's good tracking of any side effects that people have. And these will continue to be monitored probably for years to come. One of the concerns that some people express about the COVID vaccines is the risk of anaphylaxis. And again, anaphylaxis is a severe allergic reaction. Of course, it needs immediate treatment. It is fairly easily treatable with epinephrine in most cases and usually resolves after that. But this is quite rare. In fact, it's in the range of 2 to 5 times per million doses. And there've been, well over 100 million doses in the US given thus far. So while it does happen, it's an extremely rare event and very treatable. And that's why we have the 15 to 30 minute observation period after vaccination, because if it's going to happen, it's likely to happen during that time period. And that's why they have you wait, and there are people there to respond as needed.
What are the symptoms?
Symptoms of anaphylaxis? Yeah, symptoms can be, certainly you can have swelling. The major concern is airway swelling. So, if people have trouble breathing or, are having hives, that is an immediate anaphylactic reaction and needs to be treated. But the major issue is, difficulty breathing. That's the one we're most concerned about. Okay, and so this was as of March 15th, there were 109 million doses, so it's a little higher now, of course. I hadn't updated that slide. The VAERS system does receive all reports of death that happen around the time of vaccination, not caused by the vaccine, but just, around the time soon after vaccination. And in all of these cases are reviewed very, very carefully by the CDC and the Food and Drug Administration. And there have been no cases of the, around 2,000 that have been reported that were actually attributed to the vaccine. There was some other underlying cause for that person. And these are pretty comprehensive reviews of each death that happened around the time of vaccination. So again, I think that gives us another assurance that the vaccines are quite safe. Here's just a photo of some of our staff out doing a vaccination clinic on the coast. So what are the public health recommendations after COVID vaccination? So full COVID vaccination is 2 or more weeks after you have received the second dose of a 2-dose series. So if you had Pfizer or Moderna, 2 or more weeks after the second dose, or 2 or more weeks after you receive the first and only dose of the Janssen vaccine. Excuse me. Fully vaccinated people can visit with other fully vaccinated people indoors without wearing masks or social distancing. And they can visit unvaccinated people from a single household who are at low risk without wearing masks or social distancing. In addition, if they have no symptoms after a COVID exposure, they do not need to participate in quarantine or testing. Now, these are the allowable things. Obviously, people can do whatever they want to be even safer than this. But these are the CDC recommendations. But fully vaccinated people should continue to take precautions in public, including wearing masks and physical distancing. They should continue to wear masks and practice physical or social distancing when they're around unvaccinated people who have an increased risk of COVID. So someone who is over 65, someone with chronic medical conditions, etc. Obviously, they should follow any guidance issued by their employer. And when they're in groups with multiple households where there are unvaccinated people, fully vaccinated people should continue to wear masks and maintain social distance. They should avoid medium and large size in-person gatherings. And if they do experience symptoms of COVID, they should still get tested. Even with a high rate of effectiveness, you know, there are always a small number of cases even among vaccinated people. And these are just some of the collateral that's coming out from the state health department, you know, promoting vaccination as a safe and free and helping to stop the pandemic. And the next few slides I'll go through fairly quickly. They just talk about the vaccine distribution process in San Mateo County. So I think, as many of you are probably aware, healthcare workers were the first group eligible for vaccination. That's about 48,000 people in San Mateo County. Residents of long-term care were also as part of that first group, as well as staff, and that was about 12,000 people in San Mateo County. After that, adults 65 and older became eligible. That's about 130,000 people in the county. And then on February 22nd, we opened it up to workers in education, childcare, food, agriculture, and some first responders. That's approximately 37,000 people. Now we just started in the new phase, which is the third box here, and that's adults with significant chronic medical conditions. And it also includes residents of other congregate facilities, so homeless shelters, those who are incarcerated, those who are in mental health or substance abuse facilities. And we estimate this to be about 200,000 people in San Mateo County that became newly eligible as of March 15th. So you can imagine there's a lot of demand and not a lot of supply of vaccine for that group. And I think this is just an acknowledgement that, you know, it's when you have low supply, we have to both reach people very quickly, but we also have to try and reach people equitably and not only reach those who find it easy to get to a vaccination center, who have insurance, who speak English, etc. We have several dashboards on the county website that you know, allows you to track what's happening with vaccination. There have been some data glitches in the last couple of days. So the most recent data is from March 20th. So we don't have more recent data than that yet, but we hope to have it soon. And similarly, we have data posted on vaccination equity. So you can actually look at various census tracts in the county and identify vaccination rates, particularly for the lowest quartile of census tracts in terms of the quartile. It's called the Healthy Places Index, and it's based on income and other socioeconomic factors. So that's a really brief run through with both some information about the vaccines, information on side effects, and then a little bit about a distribution process. Obviously, happy to answer questions or hear comments on any of this. Thank you.
Dr. Chopra, maybe we can go through the 3 questions that came through email last night. So the
Sure.
first question is, you talk about high risk condition. Is asthma considered a high risk condition?
Yeah, based on the state's criteria, asthma is not listed as one of those conditions. I think one could make the argument that someone with severe uncontrolled asthma might meet the criteria, but sort of mild or moderate asthma would not.
Okay, got it. And then the next question is, for my grandkids under 16, when do you anticipate vaccine for them?
That is a good question. So we don't know with any certainty, of course, but there are studies happening down to age 12 at this point, and then there's other studies that I believe are just starting going down to age 5. So what I've heard is that for younger kids below age 12, it'll probably be next year sometime,
Okay.
so 2022. For the between 12 and 16 or 12 and 18, I think it'll happen sooner.
Great. Thank you. So the third question on the email is, 2 weeks after my second dose of Moderna, I'm having what I assume are delayed reactions to the vaccine: headache, fatigue, nausea, no appetite, and sore throat. And this person got a negative COVID test on Monday. So
Mhm.
is this normal, late reaction?
It's certainly not typical. You know, with vaccines, almost any reaction is possible. So I think, like this person did, that they should consult with a physician to determine whether it's related to the vaccine or not. And if their physician thinks it's related to it, then they would report it into the VAERS system. But it's also quite possible that it's just a totally unrelated viral infection that came up later.
Great. Thank you. Let me look at the board. One of the question on the chat is related to your slide on equity.
Mhm.
This person asks, East Palo Alto has 300% more cases than Menlo Park per capita, yet only has half the vaccination level, 19 versus 38%. So the question is, why has this happened, and what is the plan to close this massive gap in the community with the worst COVID numbers in the Bay Area?
Yeah, so thank you for bringing that up. We are very aware of that, and that's why we're focusing right now most of our efforts in communities with the lowest vaccination rates and the highest COVID case rates. So this week, next week, you know, in the coming weeks, we'll continue to do intensive efforts, really focus on those communities, which include East Palo Alto, Redwood City and North Fair Oaks, some parts of the city of San Mateo, some parts in North County, like South San Francisco and Daly City, and then some areas out on the coast. But because of those very reasons, that's why we're focusing intensive efforts there right now.
So I guess the next question related to that is the messaging on those areas. Will it be in Spanish, Togan, and Samoan? So there's a communication.
Right. Yeah. So there is a work group called the Health Equity Work Group that advises us on this. They meet every Thursday, and they have participation from over 100 community organizations, including ones representing, you know, Latinx communities, Samoan and Tongan communities, you know, other Asian communities, etc. You know, it's a broad-based coalition, African American, of course. And so, yes, we're trying to get all the information out in multiple languages, including those languages, so Samoan and Tonga and Spanish, of course. Some of the Chinese, both simplifies, a couple versions of Chinese, Tagalog, etc., to make that available. So we haven't always, this is an ongoing iterative process, of course, and so we're, each time trying to add more things in, but yes, we recognize the language issues.
Thank you. Let me look. One question, is the vaccine safe for pregnant women?
It's a good question. The vaccines were not tested on pregnant women, but they appear to be safe. But we recommend people talk to their physician if they're pregnant.
Okay. And then I think one question is, can two people from separate households that have been fully vaccinated get close and hug without masks?
Yeah, so based on the public health recommendations from the CDC, two people, separate households, fully vaccinated can get together without masks, indoors if they want, they can hug. Yes.
And I remember you mentioned they can hug, they can also be with somebody who is not vaccinated as long as they're low risk.
That's correct, if it's from one household.
Right. And low risk being not having a condition that CDC consider high risk.
Not one of those health conditions, not over 65. Those are the main criteria, not immunocompromised, not having some underlying immune issues. Ideally not pregnant either, because that's considered one of the health conditions. Of course, pregnancy is a normal condition, but it is considered one of the health conditions because it puts you at risk of more severe complications from COVID.
Okay, I think we went through all the questions on the chat. Does anybody have any questions that they want to unmute themselves and ask?
Yes, I have a question. My daughter and her son and her husband got COVID. They have 3 kids and all 3 tested positive, but are asymptomatic. Can their parents get the COVID again from the kids?
It's thought to be extremely unlikely to get COVID within 3 months of the first time you get it. So it's highly unlikely that you get it again in within a few weeks of the first time. There have been a very small number of cases of people who've gotten it again, but it's usually several months later. So it's unlikely.
Thank you.
Is it true that if you have side effects, people are saying it's better because it means your immune system is taking it?
Is working.
You're safer? Yes, it's working.
That is believed. Yes, I mean, I think that's basically true, that the side effects mean you're mounting an antibody response to the vaccine, which is what you want to happen. That means your body's producing antibodies that will fight the virus if you get exposed to it.
Okay, thank you.
That means I'm in trouble because I didn't have any side effects, first or second.
It is true that the amount of side effects tend to get lower as you get older. So
I qualify for that one.
So folks over 65, for example, tend to have fewer side effects than folks who are under 65.
Thank you.
Any other questions for Dr. Chopra? Okay, well, thank you so much, Dr. Chopra, for joining us and answering our questions. Thank you. And thank you for your hard work in rolling this out. I know this is a big feat. Thank you.
Thank you so much. Nice meeting you.
Thank you.
Take
Thank
care.
you.
Goodbye.